deaths per day over the last 7 days. Today, I want to spend a little time discussing COVID-19 testing and why this remains a critical component of our comprehensive approach to ending this epidemic. Reliable and widely available testing is a crucial part of our efforts to stop the spread of COVID-19. But several factors can make testing strategy decisions complex, including the different kinds of tests available, the changing dynamics of the pandemic in communities, and the increasing proliferation of new variants that are more transmissible. Having clear, evidence-based recommendations to help state and local public health departments and the medical community make informed decisions about COVID-19 testing is paramount to an overall national testing strategy. Today, CDC is releasing a suite of 5 updated guidance documents on COVID-19 testing, building on the latest science, available testing options, and what we have learned about testing during this pandemic. Our testing overview guidance describes the available tests that are used to detect COVID-19, how to choose a test, and the reasons for using them. They also explain the impact of vaccination on testing. Importantly, until now, limited test capacity has resulted in our use of tests for largely diagnostic purposes, when someone presents with symptoms or has been exposed. Only in selected places have we capitalized on the benefits of how testing can be used as a screening intervention with frequent tests to identify asymptomatic disease and prevent clusters before they start. Testing can also be used as a surveillance tool to monitor the burden of disease in communities. Our newly released set of guidances offers a comprehensive approach to testing and helps to prevent the spread of COVID-19 through the rapid identification and isolation of people who are infected, including those who do not know they are infected because they do not have symptoms. The updated overview also provides new information about health equity issues related to testing. To end this pandemic, everyone must have equal access to affordable and timely testing with fast turnaround time for results to identify infections and reduce community spread. In addition to the overview guidance, we are also releasing 4 complementary guidance documents that focus on testing in specific settings, including correctional and detention facilities, non-healthcare workplaces, institutions of higher education, and homeless shelters and encampments. Each of these companion documents, guidance documents, provide tailored recommendations that take into account the unique circumstances and risks for COVID-19 spread in the different settings. Today's updated guidance is intended to help public health officials, medical providers, school and justice system administrators, and others make decisions about setting up testing programs in their communities. All 5 guidance documents are now posted on our website at cdc.gov. And while guidance is critical to informing decision-making for COVID-19 testing, it's equally important that testing programs in communities are supported with resources to do the work. This requires much needed and long overdue resources. So I'm proud to share that CDC is announcing new funding for $2.25 billion in grants to public health departments, on average $20 million per grant to more than 100 health departments to address COVID-19 health disparities and advance health equity among people who are at high risk and underserved, including racial and ethnic minority groups and people living in rural areas. A large component of this funding will focus on strategies to improve testing and contact tracing, along with funding to support continued implementation of prevention strategies for COVID-19. These funds will provide much needed funding to states, cities, counties, and rural locations. I'm so excited to report that this funding represents CDC's largest investment to date to support communities that are affected by COVID-19 related health disparities, especially those in high risk and underserved groups. This is truly a historic investment for CDC and an important step forward to help hard-hit communities turn the corner on this pandemic. Thank you, and I'll now turn it over to Dr. Fauci.